Hello, and welcome to Chapter 11 in Healthcare Supervision. We are talking about organizational structure of health information management. If you want to follow along in the book, we're starting on page 221. So, we already know, just from being in this program for 2 years and reading through this book, that the health information management landscape is changing at a fast pace. HIM students and practitioners need to keep pace with the changes that are significantly impacting the HIM field. HIM professionals need to be cognizant of the environmental factors that are affecting the profession and learn how to adapt to these changes. The largest single change for the HIM professional is the implementation of health information technology and the bearing this technology has on the task and job roles needed in the healthcare organization. I can attest to this. When I went through this program here at ICC, I started in the fall of 2002 and I graduated in the spring of 2004. There were not very many electronic health records in place. And when I went and did my directed practice at North Mississippi Medical Center, it was a paper world. And when I started working there in June of 2004, that's when we really started transitioning and trying to get away from paper or manipulating paper or using paper to analyze for the physician deficiencies and coding from paper. And that didn't happen for us at North Mississippi Medical Center until February of 2007. So once that happened, there were a whole lot of changes. We went from 3 shifts of people because you had to have people to move the paper to there no longer being paper that needed to be moved. So we need to, again, be so cognizant of everything that's going on, all of the changes, and make sure that we're adapting to those changes. Now, let's move over to 221. Let's look at healthcare organizational models and health information management. So the healthcare organizational structures where HIM professionals are employed differ from organization to organization. Organizational structure is the hierarchical arrangement of the lines of authority, communications, rights, and duties of an organization. HIM is an organizational department without walls and is becoming decentralized in healthcare organizations. The introduction of healthcare technology has allowed those whose HIM jobs were bound by paper records and the physical location of these records to now be performed in different locations throughout a healthcare organization and even within the employees' homes. The visible walls that were once evident in all HIM departments are no longer tethered to the physical location of paper health records. So again, 15 years ago, all of your coding staff worked from home. They coded from a paper chart, and you can't do that from home. So with the advent of document imaging or electronic health records, you totally had a changed landscape of what the HIM department looked like, because in some cases, especially at North Mississippi Medical Center, at least 50%, if not more, of the employees actually work from home between both transcription and your coding department. Now, dropping down into that bottom paragraph there, where you see the blue term organizational chart. An organizational chart is a graphic representation of an organization's formal reporting structure. It aids in understanding the reporting relationships and functional responsibilities throughout the healthcare organization. Now, dropping down into the next section, we have 2 types that we're going to talk about. We have the hierarchical and the non-hierarchical organizational charts. Now, line management, or the hierarchical organizational chart or structure, clearly defines the chain of command. That's our reporting structure within and outside of HIM departments, and is hierarchical from the executive level to the frontline level. Line management is traditional and the least complex management structure in which top management has total and direct authority and employees report to only one supervisor. And you can see an example of an HIM hierarchical or a line management organizational chart on page 223. You see that you have your HIM director at the top, so that's our executive level within the department. And then you have the different managers that report to that director underneath. And you see they're all on the same level. So those would be called what I would have called a peer. If we have the same boss and we're both managers, then we're peers within the department. Now, over on the next page, it talks about how hierarchical organizations tend to be stable and predictable as work rules are documented and strictly enforced. Classical management styles are deployed in these organizations, and career progression is linear. The span of control is clearly defined in line management organizations, and decision-making is centralized with each manager. Span of control is the area of activity and number of duties and employees for which an individual or organization is responsible for managing. So at this point, if we go back to our figure 11.1 at the bottom of 223, we see again our HIM director is the top dog in our HIM department. And underneath that director, we have 4 managers. Well, each one of these managers is going to have employees that fall underneath them. So the span of control shows that the HIM director has control of everything. Okay, so imagine there's more lines coming off under data quality manager. And so now our data quality manager, they're going to have some employees that they are in control of. The coding manager is going to have coding staff, and they're in control of them. But the data quality manager does not have any span of control over coding employees, nor do they have any span of control over the electronic record manager employees. Okay, so it's a bottom-down thing. So our HIM director, again, is the top dog. They have span of control over the whole department. And then each manager has their own span of control over their employees. All right, let's get into our non-hierarchical organizational model. Okay, so this is emerging as a healthcare organizational model because they allow for more responsiveness within a changing healthcare environment. Non-hierarchical organizations are relatively flat with very few layers, and each layer reports to a single individual. In a non-hierarchical organizational model, there is no true line or hierarchy to report within the organization. Non-hierarchical organizations reflect a combination of interconnected horizontal networks. The non-hierarchical organizational structure combines aspects of functional and divisional hierarchies to create a rather complex structure where an employee may report to one or more managers. Now, if you go over to the next page on 223, you can see in figure 11.2, this is an example of a non-hierarchical organizational chart, and this is our revenue cycle management department, okay? So you see our coding manager and our billing manager and our case management manager have dotted lines to each other. So they have to work closely together. Then you have hospital coders and physician coders reporting to a coding manager. And then you have hospital billers and physician billers reporting to the billing manager. And then you have case coordinators reporting to your case management manager. But they also have a dotted line. So you have some interconnection there. If you go back to 223 and you read down in the bottom, it says, define the second paragraph, the next to last paragraph on the page. It says, defining reporting relationships is essential for all HIM managers and employees. Unclear lines of authority or links to overall healthcare operations can cause confusion. Now, dropping down just a little bit, in our non-hierarchical example for revenue cycle management, there are several different areas. We talked about those: hospital coding, physician coding, billing, case management, that all work together to perform the necessary work to manage the revenue stream within the healthcare organization. The responsibility for performance outcomes in non-hierarchical models is shared by all managers at the same level. So they are all responsible to each other and for each other of ensuring that that revenue stays moving. All right, so let's talk about transitioning organizational models. This is going to play into your assignment for this chapter. I want you to be sure to read through that whole paragraph, and again, it does reference chapter 5, which goes back to change management. So typically the executive leadership in a healthcare organization decides on the organizational structure, but HIM professionals may have a chance to provide input regarding the structure as mergers, acquisitions, and combining of related services occurs within a facility. Now, our assignment is going to be an actual merger of hospitals. So you're looking at merging two HIM departments. So again, use this section, use your own imagination, and then of course you can always reference back to chapter 5 when we talked about change management. HIM professionals should be judicial in setting the organizational model for a department, as change may be difficult for many individuals, and the rationale for the change must be justified and communicated throughout the healthcare organization. The most important element when transitioning between organizational models is to provide facts and data that support the need for change and keep all individuals involved in the decision-making process. Overall, the keys to success for transitioning from a line management or a hierarchical model to a non-hierarchy organizational model include building strategic relationships throughout the organization rather than just reporting relationships, and developing solid collaboration skills that can be applied within the HIM team, as well as throughout the organization. The HIM manager can develop an innovative culture that fosters employees who can work in a complex, flexible, and adaptable work environment. All right, so let's move on to committees. Now, committees are a big thing, and you probably saw this when you did your directed practice at your facility, but we have lots of committees within healthcare. Now, HIM professionals need to know the impact of the organizational models and how they relate to health information operations. They also need to know how the committee structure within the healthcare organization affects their HIM operations. So, what is a committee? Well, a committee is a body of persons delegated to consider, investigate, take action on, or report on some matter. Committees provide a framework for interdisciplinary teams to manage process outcomes, assess quality, offer guidance in ethical decision-making, review appropriate consumption of resources, and provide administrative guidance for healthcare operations. Silos develop within healthcare organizations because of the specialized nature of the task each department or area performs. Committees help mitigate the effect of silos on healthcare operations, and they bridge the gaps that occur between medical or clinical and administrative or supportive departments. HIM does not rely on committees for day-to-day management, but committees can provide support for the overall operations in the healthcare organization. Now, dropping down into that last paragraph before we get to table 11.1, committees are a part of the formal structure of a healthcare organization with assigned distinct purposes and functions. The formality of the committee structure affords healthcare organizations the ability to require committees to be accountable for their actions. And so if we look at some of these committees, I do want you to be familiar with table 11.1 that starts on 225 and finishes up on 226. But it talks about each committee. It lists their functions, who the interdisciplinary team members are, and then the functions of HIM in relation to these committees. So let's use infection control as our example. They review infection rate trends, benchmark healthcare organization infection data against similar organizations. They develop and implement infection control policies and procedures. Some of your team members may be nurses, physicians, the clinical laboratory, and pharmacy staff. And HIM's function in the Infection Control Committee may be provide reports on infection rates based on the data that they coded. So, again, I want you to be familiar with table 11.1, and we're going to move on over to 226 here. Smaller healthcare organizations, such as physician offices or clinics, maybe a small community hospital or critical access hospital, they're going to have one or two committees that may be responsible for multiple functions for that entity. So again, it's all depending on the size of your healthcare organization. Now, we do have special ad hoc task forces. These are groups formed for a specific task or objective, and they're assembled as needed. That's kind of the whole term of what ad hoc really means. Ad hoc is just kind of like on the fly as needed, and usually once they perform the task that they were assigned, they're disbanded. So it's not a permanent committee that's a part of the hospital. It's just a task force that comes together to solve one problem. They've solved that problem and then they get disbanded. So it's no longer a group or a task force. Now let's talk about purposes of committees. So committees can be temporary or they can be permanent. The purposes and uses of committees in general are to engage a multidisciplinary group of healthcare individuals in the decision-making processes that impact a multitude of services within that healthcare organization. Patient outcomes are dependent on a variety of healthcare individuals working together. So let's talk about committee structure. So the structure for most committees includes an appointed chair of the committee, and often this role is rotated throughout the membership of the committee yearly. New committee members should be oriented to the committee by the committee chair or another returning committee member. Agendas and minutes of the committee meetings are created and used as a guide for managing each committee meeting. These documents are saved in an appropriate manner and are accessible to the committee members and the healthcare organization's executive team. Agendas are created based on the functions and requirements of the committee and are sent out to all committee members prior to the meeting. Some of the committees may discuss issues that have protected status, such as physician peer review committees. So the minutes of these meetings should be retained in a private or confidential manner. Now, I'm not going to go through accreditation committee and quality management committee. I do want you to read through those yourself. We are going to look at some of the specific HIM committees. Our slides don't really go into a lot of detail as far as these next few paragraphs go, but I did want to cover these specific HIM committees. Now, a lot of times, and again, every department is different. It's going to depend on the size of your organization and the number of employees in your department, but a lot of departments have employee activity committees. This committee, they may be the ones that get ready to plan baby showers for their coworkers, or they may be the ones that would send a plant to a coworker when they have a family member to die. If you have a coffee pot and you have a little coffee club, they're the ones that are going to be responsible for saying, hey, we need more coffee, or they say, hey, you're going to make coffee this morning and I'm going to make coffee tomorrow. So that's what your little employees activity committees kind of consist of. The next one is your HIP week. This is a big one. HIP week is usually something that healthcare organizations kind of make a big deal about. Each different discipline within the hospital has a week to celebrate their profession. And so HIP week, which traditionally was in November, moved to March a few years ago. So during HIP week, you have, different things going on in the department. You may have a jar of candy, and whoever gets the closest guess of how many jelly beans are in the jar wins a prize. Or, a long time ago, we would buy t-shirts for all the HIM employees, or we may have a dinner catered and everybody gets to come in and kind of mingle and have that free time there to just enjoy our time together. And so HIP day or HIP week sometimes is a very big deal for your department. It's just a way to celebrate your profession. And then again, let everybody else know what's going on in the HIM world. Okay, then you can have performance improvement committees. So again, they can be organized to help manage a variety of performance initiatives that cross multiple areas in the department. Then you can have an HIM committee. Now this one is a big one because this one is joint commission required. Typically your HIM director is the chair or sometimes a co-chair. Now if you have an electronic health record, possibly someone from your information technology department will co-chair that team with your HIM director. Now, this committee, it says, provides healthcare organizational support in terms of managing all aspects of health information, including approval of documentation templates, paper forms management, physician chart completion issues, record and retention policies, and copy and paste policies. And it's very important that the HIM director keeps the HIM committee well informed on the issues impacting health information throughout the organization. And then you can have specific HIM work groups. Now, these teams may meet on a regular basis to discuss specific job tasks, provide training and ongoing education, and develop team cohesiveness. Examples of HIM work groups that might meet on a regular basis are your coding and your CDI team. Those two groups work super close together. And so it's good for them to get together and make sure that the lines of communication are open and that they continue education, and then they can talk about any clinical topics that come up that will impact the coding area, anything that the CDI nurses are seeing out on the floor. All right, so let's talk about a few of the limitations and disadvantages to committees. Okay, so one of the disadvantages is committee structure and activities in the healthcare organization have to be supported by your executive management team in order for this model to be constructive. If you do not have top dog management support, it's really hard for that committee to actually get together and do their job. Also, if you need to make timely decisions, well, the committee may not be the right route to go because you have a lot of different competing personalities that have different thoughts, different thought processes, and so if time is of the essence, committee is not the way to go. Another thing, sometimes if you're in a meeting or you're in a committee meeting, you may have all these little sidebar conversations going on. So you got these two whispering over here on this side of the table and these three whispering over here on the other side of the table. You want to make sure you have a cohesive group. Committee members all need to engage in discussion at the meeting. And then all of your members should be versed on the mission and vision of the committee and play a key role in ensuring that the committee functions are carried out appropriately. Committee structure is an effective way of managing complex healthcare organizational issues, and HIM professionals should be aware of the role that it plays in regard to this model. All right, moving on to our external and internal influences on HIM. This should be a review we should have talked about at some point in your time here at ICC, internal influences and external influences. And once we start talking about these, the light bulb will go off. But your external forces are the influences, resources, and activities that exist outside of the healthcare organization, but significantly impact and affect HIM. Government agencies. Think about CMS, AHRQ, the Office of National Coordinator. Think about state regulations that come up. Think about HIPAA, privacy and security. Think about new models of healthcare delivery that recently have come up in the last several years, like your accountable care organizations. And then think about reimbursement. I know you're going through the reimbursement course right now, but there are changes in health insurance and healthcare reimbursement models, every few years or so. So those are all external. They happen outside of the organization, but they impact HIM significantly. Now, internal forces are the area of focus that the manager needs to address on a daily basis so that the HIM department performs at its peak level. So again, whereas external influences are outside of the organization, well, your internal influences or your internal forces, they are inside your organization. These are the things that are kind of under your control. So budgeting, staffing, training and development, managing actual HIM functions, effective and secure use of health information technology such as PHI accessibility, and then changing our organizational models from line management to non-hierarchical in order to keep up with the pace of change in healthcare. So, some of the ways that we can mitigate the effects of these influences on our day-to-day operations is 1, provide better opportunities for integration of healthcare information across the continuum of care. 2, develop processes and systems that promote the understanding and the use of health information by patients and families. And last, reframe the way coded data and information is used to obtain payment in a system that rewards quality and efficiency of services over the traditional emphasis of quantity of services. So those are some of the ways that we can mitigate the effects of these influences. All right, let's get into our professional organizations. Now, this is another table. It's a large table. I do want you to be familiar with this table. So there are a variety of professional organizations that can offer assistance and support to HIM professionals depending on the job roles that might require additional support outside of the traditional HIM field. Now, we all know that AHIMA, American Health Information Management Association, is the leading source of HIM knowledge, and it is a respected authority for rigorous education and training. Now, it's the premier association to which HIM professionals should belong in order to benefit from a multitude of resources available. The AHIMA body of knowledge contains the most current and relevant articles, white papers, conference proceedings, and practice briefs supporting HIM initiatives. AHIMA provides the oversight of HIM certifications like the Registered Health Information Technician, the RHIT, and the Registered Health Information Administrator, the RHIA. Now, flipping over, we get into Table 11.3. And so we have about 2.5 pages of organizations here. And some of these you're going to be familiar with, and then some you may not be as familiar with. But you have the name of the organization, the purpose of the organization, who the membership is, and then what that organization's impact is on HIM. So I do want you to be aware of these organizations. There are 5 on page 230. There are 4 on page 231, and then there's 2 on page 232. So just be familiar with these different organizations and how they influence HIM professionals. All right, let's keep moving on to page 232, and let's talk about competitors for our HIM roles. You will get some HIM people fired up over the fact that there are people out there that do not have our in-depth training that are taking our jobs. They will be fired up. And I can be one of those at times. I can. So when we talk about professional organizations that impact HIM, and let's go back and talk about one real quick. Let's use HIMSS as an example on 231. That's the Health Information Management Systems Society. So membership typically includes physicians, nurses, IT professionals, HIM professionals, IT vendors. Well, think about electronic medical records. Does that not seem to fit right into HIMSS's, wheelhouse? Their purpose is global, cause-based, not-for-profit organization focused on better health through information technology. HIMSS leads efforts to optimize health engagements and care outcomes using information technology. So here we are as HIM professionals through AHIMA, supporting installation of electronic health records, and yet here you have HIMSS, that's their purpose, to improve care of patients using information technology. And so a lot of times you have people that may be more techie than we are, that work in IT, that come in and sometimes take roles that HIM professionals should or could take as well. Moving over, staying relevant, okay? It is so important to stay current and relevant as an HIM professional because there are many individuals outside of HIM that are waiting or competing for typical HIM job roles, okay? So let's not even, we can talk about the information governance, that's an IT kind of thing, but let's talk about this from another aspect. CDI, clinical documentation improvement. A lot of organizations will only hire registered nurses for clinical documentation improvement. But a lot of facilities do hire HIM professionals, RHIAs, RHITs, certified clinical or certified coding specialist, the CCS credential. So you have people that can take that role from an HIM professional. People in the revenue cycle, people in cancer registry, people in different leadership positions. So people are waiting to take our jobs. And if we do not stay current and we do not stay relevant and we do not stay with the times and understand that technology changes, the healthcare landscape changes on a daily basis, these people will swoop in and they will take these jobs right out from under us. Healthcare professionals will require further education, analytical and critical thinking skills, and additional clinical knowledge. Because again, to be an effective clinical documentation improvement specialist, you need to have that clinical knowledge. An RN already has a leg up on us with their clinical knowledge. So if we can keep our knowledge base solid and we can get that additional clinical knowledge, then we have a better chance of keeping those jobs within our profession. All right, let's talk about AHIMA's guidance for professionals. Now, AHIMA's primary goal is to provide knowledge, resources, and tools to advance health information professional practice and standards for the delivery of healthcare. The AHIMA Board of Directors, along with the AHIMA House of Delegates and Envisioning Collaborative, develop strategic goals that help provide guidance for health information practitioners when managing health information in today's healthcare environment. Now, in 2019, the mission was empowering people to impact health. And the vision is a world where trusted information transforms health and healthcare by connecting people, systems, and ideas. Now, some of the ways that they want to help us stay relevant is assisting in developing the HIM workforce, and you can kind of see this over in table 11.4. So assisting in developing the HIM workforce, where we can educate others within the healthcare organization about the value and the skills of the HIM professionals and the role that we play in healthcare outcomes. Not everybody knows what HIM is. I mean, people don't think about, especially if they're not familiar with healthcare, they don't understand or comprehend that there are professionals out there that work with the medical record to ensure that it is a legal, complete document, or people that actually go through the healthcare record and are coding that to ensure that that hospital gets recognized for the severity of illness and the risk of mortality of the patients that they're taking care of on a daily basis. So we need to, as professionals, use that knowledge that we have to educate others. Also, transitioning HIM professionals to future roles by enhancing education, competencies, and skills. Develop job roles and job descriptions that match the current and our future HIM skills. And then help all HIM professionals within your department to be progressive in action and thought. So those are the ways that we assist in developing the HIM workforce. Next, champion information governance and management of information throughout the organization. So why don't you volunteer to lead an information governance task force? Step up and volunteer to be on the information governance team if you've already got one. Lead by example within the HIM department by developing policies and procedures outlining information governance performed within HIM. Then perform informatics. Create those reports on your coded data. Get those service line statistics and the data out there. Show that severity of illness and risk of mortality for certain units or certain departments. Develop mapping tools for classification systems and terminologies that help the healthcare organization understand current and legacy data. Review externally reported data for data quality and data integrity. A lot of times your quality departments can do that, but HIM does help because HIM is the one that is supplying the data to these quality departments. Take a course on statistical analysis or data analytics to advance your skills. Partner with a local health information exchange organization to analyze and evaluate community or regional health information data. And then last, engage in data analytics skills. Okay? So engage in research activities or performance improvement initiatives that result in better management of your health information. Develop skills in utilizing data analytic tools such as Excel. And then interpret healthcare data to influence the operations and your patient outcomes. Now, I'm not going to talk anymore about the American Health Information Management Association Educational Curriculum Competencies in Practice. That's on 233, and then again over on 234 and 235. If you look on 234, you should be familiar with the domains. These are the domains across all academic levels. So again, you should be familiar with these. They don't necessarily line up with the domain structure that you're familiar with for the RHIT exam, but they are very closely related. But it goes on to talk about the different associate degree academic programs and how with sorry, I'm getting tongue-tied here. With HIM Reimagine, which it talks about over back on 233, they're wanting in the associate degree programs 2 different tracks. And sometimes programs have the choice of choosing both tracks. But one track is revenue management and the other is data management. So data analytics, being more familiar with how to utilize and engage in that research and use those analytic tools. Then revenue cycle, of course, coding, billing, ensuring that we understand the reimbursement systems that are currently in place. So be sure to read through that section. I do want to move on to emerging roles in HIM. HIM emerging roles are limitless, and many of the skills and talents exhibited by HIM professionals span a wide variety of knowledge. The foundational curriculum competencies provide a baseline for new HIM graduates as well as a guide for practicing HIM professionals. Mastery of all competencies is not possible for any one individual because of the wide array of knowledge competencies identified for HIM professionals. So I'm going to go ahead and tell you this. We teach you a lot of things in this program, but when you get out there into the workforce, you're not necessarily going to remember what we taught you because you may not use that information or that knowledge on a daily basis. So if you go out and you become a coder in a large facility, coding is all you're going to focus on, okay? You're not going to be worried about when a history and physical has to be completed on the chart. You're not going to worry about release of information rules. You're not going to worry about a lot of things. Focusing on coding is going to be your job. And so again, a lot of these smaller facilities, you may go in and you may do everything. You may do release of information. You may code. You may scan. And so you would be more well versed in the knowledge competencies for HIM professionals. Now let's look at that next paragraph. One emerging role that is best suited to the skill set of health information professionals is enterprise information management and governance. EIM aligns people, processes, data, and technology with information policies and practices throughout an entire healthcare organization. Traditional health information record practices need to be expanded to encompass management as an asset through the healthcare organization. A broader range of knowledge is required for embarking as an EIM manager role, as skills should be included a combination of the following items. So, leadership skills, in gaining collaboration and cooperation, privacy and security issues. You need to be able to manage that, know that. Understanding and applying the concepts of data quality and integrity enterprise-wide. Development of clear and concise data dictionaries for managing enterprise-wide information area is imperative. And then creation of information policies and procedures and standards can be utilized by healthcare organizations to meet operational needs. Another emerging role is population health management. Population health is the capture and reporting of healthcare data that is used for public health purposes. It allows the healthcare provider to report infectious diseases, immunizations, cancer, and other reportable conditions to public health professionals. Okay, some other emerging technologies which you should learn about: computer-assisted coding. These technologies will change the role of traditional coding. So the CAC software is going to extract and translate diagnostic and procedural information from a health record into ICD and CPT evaluation and management codes for billing and coding. So it's going to use natural language processing to auto-generate codes for the coder to go back, and then they become an editor, not a coder, kind of like transcription on front-end dictation or back-end dictation. The transcriptionist, if the information is already typed for them, whether a physician used some kind of front-end speech or there's back-end speech on the transcriptionist side, they end up editing the information. Well, the same thing kind of goes along with your computer-assisted coding. The coding is done for you, and you as the coder now become the editor, and you go back and you review the information to ensure that those codes are correct. And then the last one, emerging role, clinical documentation improvement. Again, for both inpatient and outpatient specialists. These have been around for a while. Clinical documentation improvement became a big thing at North Mississippi Medical Center in 2012. And I'm not exactly sure how many employees they have now, but they do hire registered nurses at Tupelo. They are employees of the HIM department, and they are out on the floor, and they are reviewing documents, reviewing charts every day for patients that are currently in-house. And if they see diagnoses that are not specified, I always use congestive heart failure as an example. If all they see is congestive heart failure, then they want to go back and they want to get that as specific as possible so that when that patient is discharged, then that coder knows, is it systolic? Is it diastolic? Is it acute? Is it chronic? Is it acute on chronic? So having all of those diagnoses specified as much as possible before discharge just makes that revenue cycle process on the back end so much faster. Okay, so that really covers Chapter 11 for us. If you have any questions about this chapter, please feel free to get with me. And this finishes off our Supervision book. I hope you have enjoyed this content. I did. This is the first time that I've taught from this book, so I feel like it was a good representation of what supervision and management is in the HIM world. So happy reading and happy studying, and good luck on your last major test in supervision.